All across America, we're seeing a growing number of people struggle with a variety of emotional and psychological issues. Millions of Americans live with major depression, panic disorder, obsessive-compulsive disorder, post-traumatic stress disorder, bipolar disorder, and a host of other co-occurring mental health and addiction disorders. Yet nearly 60% of adults with a mental illness received no mental health services in the previous year. Of those that are able to find services, only half receive an adequate diagnosis and treatment. Experts say in order to have long-lasting effects in the treatment of mental illness and substance abuse, it's imperative to address the underlying dynamic factors that influence the development and contribute to the maintenance of such disorders. Dr. Ronald Sager, triple board certified in psychiatry, child psychiatry, and addiction psychiatry, and a certified psychoanalyst, explains.
The first inadequacy is I think that the patient or client is not fully evaluated from all levels of their development, their background, their psychological state, their intellectual state, as well as unconscious conflicts. I think that a lot of people come in, they get a superficial evaluation, and the treatment plan that develops is never really thoroughly specific for that particular patient. Most treatment programs are designed to provide relief. They want to make people feel better. And so they get superficial treatment and then they're released. Half of them don't make it out the door before they're already relapsed. And if they're drug and alcohol people. And the people that have emotional problems, it may be a couple of weeks before they start to regress. So that they have to identify the underlying unconscious conflict, and that's where the ultimate direction is focused.
Dr. Sager is the founder of Balance Treatment Center, the first private licensed mental health rehabilitation center in California. Nestled in the Santa Monica Mountains, miles from Los Angeles and minutes from Malibu, Balance Treatment Center is a private 6-bed facility with an attentive staff providing the best and personalized care. Believing that stability can only be achieved by healing and rebuilding the whole of one's life, clients are taught not to just cope with mental illness, addiction, or psychological struggles, but to modify the underlying faulty beliefs that support their mental illness or addiction.
The mission of the Balance Treatment Center primarily is to support the patient while we attempt to identify these underlying defects which are faulty since childhood and are being used by them to run their lives, which eventually will fail. We are attempting to provide them with tools that will allow them to continue that treatment, that self-development after they leave. In the meantime, in order to help them go and do that, they need outside support in all areas in terms of coping with their current life situation.
An MHRC is a mental health rehabilitation center, and that's specifically used to treat individuals suffering from emotional and psychological issues, and those can range from depression, anxiety, bipolar, PTSD, psychosis, and dual diagnosis. At an MHRC, we're treating individuals to help them regain emotional stability and healing in their life.
Innovative and vastly comprehensive in its approach, Balance Treatment Center focuses on 4 key areas in everyone's life: emotional, social, educational, and physical. When these 4 areas are in balance, true and long-term recovery and stability can be achieved.
Occasionally at other treatment centers, they'll focus on particular presenting problems or issues, and they're missing the client as a whole. At Balance, we're looking at how to heal an individual at the core and also how to rebuild their entire life. So we pull from different evidence-based techniques such as cognitive behavioral therapy, dialectical behavioral therapy, different family therapy, psychodynamic. They're encouraged to use a lot of community activities and to use their peers to encourage and facilitate growth.
By attacking the infrastructure on which the conflicts, psychological problems, addictive behavior, or mental illness are based, you can produce real and lasting change.
We're attempting to get at that part of them that they don't want to deal with. And if we have the ability to alter that in any way, that will make it successful for them. They will be successful after that.
Okay.
When our clients leave treatment, I want to see a change not only within them, but also in their support system. It's so important to me that their support system is just as educated as our clients, and that change occurs throughout the whole family. And we get to teach them how to use their teams, teach them how to advocate for themselves, and to really be educated about what they're going through. That's my favorite part, is that we get to be there through the whole process.
Demonstrating compliance with the Joint Commission's National Standards for Healthcare Quality and Safety in Behavioral Healthcare, Balance Treatment Center has earned the Joint Commission's Gold Seal of Approval for accreditation, awarded to only 6% of the nation's rehab centers.
We're attempting to alter a change in this person's character and at least give them an inroad or the tools to progress and to do that after they leave here.
The best part about my job is being able to see the clients the day they leave our center. And they leave with their heads held high. They walk out that front door with a different aura than when they walked in that door. They get to walk out strong and feeling supported, and they walk out with their families just with a whole new outlook on life.
Psychological change is extremely difficult. It's very painful. People don't like to do it. But if they don't do it, they are going to fail as they failed before. They'll keep repeating that. They have to change that in order to make improvement.
For those struggling with mental health issues or substance abuse, this is the premier integrated program for long-term recovery and stability. Learn about Balance Treatment Center Mental Health Rehabilitation Center today. For more information, go to balancetreatmentcenter.com or call toll-free 855-414-8100.